Hello and welcome. My name is Dr. Molly Roberts. I'm an integrative and holistic physician with the Institute for Health and Healing, and today we're going to be talking about holistic methods for easing depression. And we're going to be talking about that in the context of mind, body, emotions, and spirit, both of how that can influence depression and also how you can use those as tools to ease and pull you out of depression, and not only pulling you out of depression, but bringing joy and health and happiness into your life. The first part I wanted to say is that you can't fix a problem until you know what it is. And so we're going to be talking about the mind, the body, the emotions, and the spirit of depression, and how not only to look at it from figuring out what the cause of the depression is, but also how you can help solve the problem once it's happening for you. So the first part I want to say, taking this from a holistic perspective, you are a combination of mind, body, emotions, and spirit. And the nice part about that is that you have a treasure trove of healing ability within you. It's just a matter of tapping into it and recognizing that they all have their place on the wheel in terms of helping you to feel better. And so a couple of facts I wanted to give you about depression. And when I talk about depression, if this is something that you are experiencing, this talk may be for you. But also, a lot of people know others who are dealing with this, loved ones, others within their community. And so this may help you to be of support to someone else who's dealing with this issue. And one of the things that I find is very hard about depression is that it's not like other physical illnesses. One of the problems with depression is that it's your mind, and you know, we often rely on our mind to get us through the physical aspects of our lives, and so when your mind isn't working quite as well as you might like, it's particularly difficult. So I just want to acknowledge that and let you know, first of all, that you're not alone, but also that there are ways to help solve this issue and help you find your way to healing and happiness and joy. And so a couple of comments about depression in general. First of all, again, you're not alone. 1 in 6 people are dealing with depression at any particular time, to the point where it's hard for them to function effectively. And that translates to about 34 million Americans who are dealing with depression sometime in their lifetime. That's a lot of people, and it can be episodic. So there may be times in your life where you felt depressed, and maybe not now, but at other times, and maybe sometime in the future. I don't mean to make you feel bad about that, because we all go through our moods, but it's just a matter of figuring out how to bring in your strengths and helping to shore up your weaknesses in terms of your mood, so that you can help yourself out of it when it does happen. So in terms of the workplace, 1 out of 10 employees are dealing with depression at any one time. And so this can affect you even if you're not going through it. There may be somebody in your work environment that's dealing with it, and it may be affecting their behaviors and their moods. And so sometimes being able to recognize that someone around you is dealing with it can help you to be more compassionate when somebody's acting in a way that is making the work area a little bit more difficult. It may frame the situation a little bit more differently. The World Health Organization found that depression was the leading cause of disability worldwide. So this is a big issue. It really affects a lot of people. And so if it's not affecting you, it's probably affecting somebody that you know, whether or not you know it. And what they found was that the quality of life was significantly altered by depression, and also that having depression influenced your other physical health, so that people who had depression didn't get better as well from a heart attack, or had more struggles with other health challenges. and your healing isn't as good, and I can talk about that in terms of how it affects your immune system. So depression can affect you on lots of levels other than just what's going on in your mind and your emotions. The other piece of it is that it can, if somebody's feeling depressed enough, if it goes outward, it can manifest as violence toward others. If it goes inward, it can manifest as violence toward yourself or oneself. And so that can look like depression, or in some other way harming yourself, or self-medicating with medications actually, and alcohol or drugs or something like that. It could also manifest inwardly by not doing as well at work, or having more trouble in school, or choosing friends who are not healthy for you, or that bring you down. And so on so many different levels, depression can affect you, more than just whether or not you are happy or sad. So I want to talk about the physical, the emotional, the mental, the spiritual aspects of this. And I picked gargoyles for the picture, and anybody who's been depressed understands that picture, can look at that and may have felt that way in the past. When it comes to the physical, it may be a relationship to fatigue. Fatigue can cause depression, but depression can also add to fatigue. So it's a chicken or the egg type of a thing. And if that's the case, you can find ways to help your fatigue, which might help your mood, or the other way around. Pain. If you are depressed, you will feel more pain. If you have a lot of pain, you will feel more depressed. And again, that comes back to the biochemical. You're using the same neurochemicals to give the pain signals as you are for mood. And so if you're using it up because you have some part of your body that is in more pain, you won't have it to help you to feel happy and healthy and all of that. So again, looking at the neurochemicals can sometimes help with this. When it comes to nutrition, nutrition can play a part again, a chicken or the egg. If your nutrition is off, you're not going to have the vitamins and the minerals to create the neurochemicals to boost up your mood. At the same time, people will stress eat at sometimes. Other people will stop eating as much when they are feeling depressed. And so the nutrition can get out of balance because of your mood. There are some people who don't clear their stress chemicals very effectively, and I can check that with testing. I can do a particular test that looks to see if you clear your stress chemicals through your liver, and if it's not moving, if it's getting stuck there, then what can happen is you can feel, I call it a stress soup. You're living in a stress soup. And a common scenario of this is that something happens that is stressful for an entire group of people, and then the stressful thing goes away, and everybody goes on about their life, but you're holding on to that stress. If you recognize yourself in that scenario, then what I would say is you may just come by this honestly. This may be how your biochemistry works. And if that's the case, knowing that and figuring that out with the testing can really help, because we can open up those pathways and help to move things on through. And then I also wanted to talk about the aspect of alcoholism and addictions. When it comes to depression, as I said earlier, people can sometimes try to self-medicate and make the pain go away in that way. What I would say, though, is that alcohol is a depressant unto itself. And so if you're taking a depressant in order to decrease your depression, it's actually working against you in that level. Second of all, if you find yourself reaching for something to ease the pain, then it may be that that you need other skills to do that in a way that won't harm you along the way. So just to make that comment, and if you find yourself heading in that direction, just make sure you get some help. On the emotional level, depression can look like sadness, hopelessness, helplessness. You may have troubles with sleep. You may feel more anger and irritability. And one thing I would say, as I was talking about earlier, if you feel that, you feel that stress coming on, and you start looking around at what is going on outside of you that might be causing it, and you start lashing out, what I would say is take that moment to sort of settle in and realize that some of this may be biochemical. And if that's the case, then it can sometimes help to settle yourself down before you go after whoever's in the room, and give yourself a moment to figure out if it's truly if it's truly the other person that's causing the problem, or if you just need some space to settle yourself down. Anxiety, I often see people who have depression and they call it anxiety or they call it fatigue. And if that's the case, figuring out it doesn't really matter what you call it. It's in a point of dis-ease, and finding a way to ease that tension and get you to a place of feeling healthy and happy is really the goal. Guilt and shame are an issue all unto itself. If you are feeling guilty or shameful, that has to do with a relationship with your own self and your actions, and not only that, but sometimes people take on the guilt and the shame of other people's actions, and I can get into that in more depth, but really what I'm saying is that if you have a feeling of guilt or shame, either around the depression or about something else that's going on in your life, then that needs its due attention as well. For some people, the depression comes on because of a trauma. There's often been times when I'm the first person that has found out about someone's rape. They've held on to it for years. And if a trauma has happened to you, what I would say is find safe space to find release for that. It may be wearing on you, and so if that's the case, it's worthwhile to get it out of your system. And then in terms of behaviors that might show up on the emotional level, for some people they can become more aggressive, and going down the spectrum becomes passive-aggressive, where there's anger there, but it's not really clear, but everybody can feel it. And on the other side of that is giving in too much. So finding your healthy boundaries in your own behavior and figuring out what is healthy for you is part of the process as well. On the spiritual side, oftentimes when it comes to medicine, people skip the spiritual, and so I really wanted to make sure that we talked about it. When I talk about spirituality, I'm not talking about a religion. I'm talking about your connections. That's how I define it. Your connections, it starts with connections to yourself. Are you in right relationship with yourself? And then it goes out into ever-widening circles. Are you in right relationship to the people that you love? Are you in right relationship to the people that you don't love? A lot of times that's work, but sometimes it's other communities in your area. And then the other spiritual questions, or at least how I define spiritual questions, are what's your meaning and purpose? What brings you, what gets you up in the morning? Who do you want to be? What brings you joy? And what tears you down, and how much of your day are you spending in what brings you joy or what tears you down? If you're spending all of your time in the things that you don't like, well, then that could be a really good reason why you're not feeling happy or healthy. And the other issues around meaning and purpose, that comes up a lot, and it's worth discussing and often gets missed, so I just wanted to bring it up. So how do you help depression? With mind, body, emotions, and spirit? And I put this picture in here. That's the beacon. That's where you find the light within the darkness. And so on physical remedies, first of all, the first part of it is to figure out what is going to be the next inroad to healing. If we've got the physical, emotional, mental, spiritual, the first step is to figure out what the cause is. What's the underlying cause? And what I mean by that is is if you're just treating the symptoms and not going after the cause, then if you fix that one symptom, it'll come out in another symptom. And so if you treat the cause, you're clearing out all the symptoms at once. And so if it's a physical cause, then you can work on it in a physical way. And so on that level, oftentimes I do testing, and I look at the thyroid, the adrenals, and make sure you're not anemic and so forth. There's some specialty testing that we can do to see what's going on the neurochemical level and that sort of thing. And I mentioned earlier about checking your stress chemicals, so we can do that as well. So those are some of the things that we can do, and depending on what we see, that drives my treatment of how to get your physical on your side when it comes to your mood. Fixing sleep problems is a big deal when it comes to your mood. If you are not sleeping well, then you're not getting that restorative rejuvenation of your body that's going to help you to feel better. And so getting 7 to 9 hours of sleep is really important. If you're not getting that, then that is one of those core issues that really needs our attention to shore up and figure out how to get you some better sleep. Pain. When it comes to pain, pain's a little tricky in terms of treating, because if we use medicines to do that, a lot of the medicines are somewhat like alcohol. They've got depressant qualities to them. And so finding other methods for dealing with the pain can be more helpful than just handing you a pill to get rid of that. In terms of environment, the environment matters. You know, this picture is of me sitting under a redwood, in a crevice of a redwood, and it was just such a restorative moment in that little alcove. And nature really makes a difference. One of my common prescriptions for people is, if they're feeling down, go out in nature and take a walk. Don't go for the long, big hike. Go for the sitting under a tree, or taking your shoes off and really feeling the earth beneath you. You can also use exercise and getting out in nature in a more quick way, so that you burn off some of those stress chemicals doing aerobic exercise. But when I'm talking about environment, I'm actually talking more about creating a coherence with nature, or really can make a difference. The other piece of environment is if your home is cluttered, or if you walk in your house and your blood pressure goes up, that can add to a problem with mood. So getting your place cleaner and less cluttered, and finding a place for things, knowing where your keys are and things like that, it can really make a big difference in terms of how you're doing. Also, often I would recommend, if you have a home, especially if you share it with others, that you create some place in your home that is like an altar. It's a place where you put things that that bring you back to some time in your life where you felt really good. And it doesn't have to be anything fancy, but it could be a picture. It could be a rock from a beach that you went to. It could be just some little something that means something to you, that whenever you look at it, it makes you feel better. And having an altar space for that can really be nice. It can bring you back to that feeling of health and happiness. And if you're doing that on a regular basis, it can become a habit. In terms of posture and expression, for years I've been telling people to smile at themselves in the mirror, and to just do that. Don't talk to yourself in the mirror, just smile at yourself in the mirror every time you pass one. And I had great success with that, and finally somebody did a study on this and found that smiling at yourself in the mirror is as effective as taking an antidepressant. So that can really make a difference. There's been some other studies looking at posture and how much of a difference it makes when you have your shoulders back and your body is in a posture of openness, and how much of a difference it makes when you're slumped over. And so those little things, it sounds small, but they work on you, and they work on the neurochemistry as well. Smiling in general can really make a difference on your mood. Try it. See, you'll see. It does. It makes a difference on your mood. And then the other part of the physical aspect is, if there is any concern about you having an issue with control over your depression. What I mean by that is if there's any concern that you might harm yourself or hurt yourself, I would suggest that you get out of your environment anything that could put you at risk in a moment of despair. And so if you have a gun in the home, hand it to someone else, get it out of your environment. If you have pills that, you have any thoughts of that, just get them out for a while until you get a little bit more control over this. And the other piece of that is I used to do work with people who are acutely suicidal, and oftentimes when they got to that place was when they were drunk or on other substances. So if you can avoid alcohol, that can keep you safe while you're trying to figure this out. The other part of this is if there's any aspect of this where you are feeling like you want to hurt yourself, please reach out to someone. Call a helpline, say something on a social network, call a friend. Let somebody know that you're hurting and you're struggling. A couple other things in terms of physical remedies. Food is medicine. Really does help. And again, I could get into the biochemistry of all of this, but these are some of the things that can make a difference. Omega-3 fatty acids, particularly if you're getting the omega-3 fatty acids from food, can make a difference. And that mostly is from fish. You can get it from some plant foods such as flax and walnuts and things like that. It's a little bit harder for you to turn it into omega-3s with the plants. It's a little bit easier with fish. There are supplements that you can take as well, but the fish really is the better of the two if you're going to have to pick one. We talked about avoiding alcohol and depressants. Gluten and sugar have a distinct effect on some people's brains. It can create it's a little harsh to call it a neurotoxin, but maybe I could call it a neurotoxin. It can add to depressed mood. And with the sugar, part of it is that your glucose levels are going up and down, and there's such a wild swing in that your moods can be affected. So getting off of those can make a really big difference in mood, and is well worth the time and attention to do that. Checking for food sensitivities, there are some tests that can help figure some of that out. There's some controversy around food sensitivities, and I often, when I do order them, I talk about that and how I use it in a way that can help us drive it forward without using it as the be-all and end-all. But the food sensitivity testing can be helpful. And eating colorful fruits and vegetables. If you did one thing, and the only thing you did was to get off of processed foods and start eating colorful fruits and vegetables, the more colorful and the more variety of colors, that would make a huge difference in terms of your mood, in terms of sleep, in terms of your overall functioning, in terms of fatigue. So something to consider. The issue of pills, using pills as medicine. There's the medicine that is prescribed, and then there's also amino acid supplements, vitamins, minerals, all those types of things, herbal remedies. And what I would say about all of that is on all of those, it's a bit of a gradation. And what I mean by that is they're all chemical reactions in your body. So it's different from using other modalities to help you with mood. But them all onto themselves, the medicines, the herbals, the vitamins, I see them all kind of in a grouping. And so an herbal remedy may have a bit less of a strong reaction for you, so it may have fewer side effects, possibly, but it also may not be quite as effective. It may have less standardization and all that sort of thing. So it's not that it's all good or all bad in terms of medicines or herbs. I try to pick the best tool for the situation and what's going to make the most difference with the least risk. And I threw this picture in. It's a picture of locks on a bridge, because sometimes people will come in with a a whole bag worth of supplements that they're taking. And what I think happens there is that you'll read about one supplement that says it's helpful, so you start taking that. Then you read about another one that says that's helpful, and so you start taking that. And pretty soon, before you know it, you've got this whole garbage bag full of supplements that you're taking. And that includes the medicines that you're taking. And, it's hard to know, once you're on all those medicines and supplements, how they're all interacting with each other. They could have all different types of chemical interactions that we could never really figure out completely. And so sometimes one of my jobs is to help kind of pull you off of some of those. If you need all of those supplements to do well, then there's something underlying that hasn't been addressed. And if we can figure out what that underlying thing is, it can make a big difference in helping you to feel better. The other piece to this is that I do testing to figure out, particularly in the nutritional aspects, what supplements you need, how much you need, and all of that. And that can help because sometimes I find that people are low on a supplement. Sometimes I find that they're too high. And so finding what seems to be the right mix, everything in moderation, as they say. Finding the right mix for you can make a big difference. Finding the right mix of the herbal remedies as well can make a difference. So it's another tool in the toolbox. It's just, I think it's important to say that if all we did was this one slide, we'd be missing out on all the other ways that you could help with depression. So these are some of the modalities that may help. And I like to use modalities partly because of that risk-benefit profile. There are some good studies showing that these make a significant difference in depression, but they are not chemical reaction. Well, they're chemical reactions in a different way, but the risk of them is significantly lower than some of the other things that we might use. And so this is a good place to start if we're trying to get your mood into a better place. Things like massage. There's good research showing that massage increases your oxytocin level. Oxytocin is a neurochemical that helps you to feel more connected to your world. And I was just hearing earlier today a new research study that was talking about happiness being mostly or significantly affected by your connections, your feelings of connections to the people that you live with, the people that you work with, and your communities. And I would add a fourth category is the connections to yourself. And so massage is one technique that you can use. There are energy medicines, there are exercises. Tai Chi, Qigong are really nice for depression. Yoga is very helpful for depression. And psychotherapy, there's something called emotional freedom technique that I really like. It's particularly helpful for if you've had traumas in your life. It can help to clear some of that, or at least clear the emotional triggers that can get going with when you start thinking about a traumatic situation. Acupuncture is very helpful for getting your nervous system sort of back into alignment. So those are some of the things that can make a difference, and also the psychospiritual techniques, somatic techniques. Sometimes when something has happened to you before you were even verbal, psychotherapy can only go so far. Talk therapy can only go so far. And sometimes it's in your body. And so the somatic therapies, the body-based therapies, can make a big difference in clearing that out. And then, of course, if you are having some issues with addiction, then a 12-step program can be very helpful as well. So some emotional remedies that can help. First of all, get counseling, seek support. You don't need to deal with this by yourself. You really don't. And in fact, if you're dealing with it by yourself, it's not going to be helpful for you trying to clear this. Depression is better cleared when you are getting support for it. So it's one of the treatments is to find you support. So seeking that out is one of the first steps to getting to the other side of it. Clearing out the blocks to your happiness, current or past. If your energy is being spent on something that happened 40 years ago, then it's energy that you could be using for figuring out your life now. And so if you know that there's something in your past that is still pulling you down, there's no time like the present to find somebody to help you clear it. Another piece to this is addressing the problem and not the easy one. And what I mean by that is sometimes what can happen is it can stay surface. You know, whatever you're talking about can stay on the surface and not go into those places that feel darker for you or are, the word I use is your shadow. You know, people can try to keep it in the light and not dealing with the shadow. But if you're willing to go to that place where the shadow is and clear out what's in there, oftentimes what will happen is it's the fear of dealing with that is more emotionally draining than actually dealing with it. And so the first part is to find safe space for you to deal with it, but the second part is to find I guess the courage to go to that place where things have been holding you down and giving it its full expression so that you can finally clear it out of your body and your mind and your soul. One other comment about all of this, sometimes what can happen on an emotional level is people can, as I was saying, you know, stay in the light and not go into the darkness. And anger is not a bad emotion. Sadness is not a bad emotion. I often see when people are grieving, oftentimes they get a pill handed to them to make them not grieve anymore. And my feeling is if you do that, then you're taking away the opportunity to find your way to the other side of that grief. And so part of it is allowing yourself the expression, to allow yourself the tears to clear it out. And in terms of the anger is often an indication that your needs are not being met. So finding a way to release that anger in a way that is not harmful to you or to someone else, you know, finding a healthy way to clear that anger and express what it is that you need can be very healthy and healing. Some other things in terms of emotional remedies that can make a difference, laughter. We often skip that one, but that's a big one, laughter. And it can be in a group with other people. It can be just watching funny movies. It can be, you know, for a while I was having people watch a comedy show every single night. And just that's what I wanted them to go to bed with was that comedy show, so that the last thing they remembered before they dropped off to sleep was some funny joke. And that makes a difference. So bringing laughter into it, there's laughter yoga that can be very helpful and those types of things. Showing love, helping others can really make a big difference. And again, I can get into the biochemistry of that, but love does heal. Hugs heal. And so finding ways to bring that into your life really can make a difference. There was a study looking at how many hugs you got in a day, and they found that the more hugs you got, the better your mood was. So finding reasons to hug. You know, I hug everybody when they come in to see me, and I hug them when we say goodbye. And you know, for some people, that's I'm the only person who has hugged them that day. And if that's the case for you, then, you know, find excuses to hug the people that you care about. And you can even hug yourself if you need to. You can pet a dog. You can, you know, find ways to bring that out within yourself. Gratitude, appreciation, loving kindness. There's some great research looking at this, and what they found was that when you are in that space of loving kindness, there's a certain part of your brain that lights up and turns on. And there's another part of your brain that is related to anxiety and worry. And what they found was that you couldn't turn on those two sides of your brain at the same time, that either one's turned on or the other's turned on. And so you can literally train yourself to go into that space of loving kindness, gratitude, appreciation, and that will pull you out of the worry and the anxiety and all of that. It is a training thing. If you are used to, if your brain is used to going to worry and anxiety, then it's a skill that needs to be learned to switch it over. But you can do it. Breathing is a big one. When you breathe shallowly, you are setting off the chemicals that make you feel more stressed. When you breathe deeply, the chemicals lower in your lung area are the ones that help you to get into that more relaxed state. So just that one thing of breathing more deeply, you can give it a try. You can give it a try now while we're talking, and see if you feel just a bit more calm while you're breathing more deeply. And when people are regularly under stress, they tend to breathe shallowly. So just bringing that into your consciousness can make a difference. My husband for a while did, he still does it, of setting an alarm on his phone to go off at a certain time every day so that he could take a moment to just sit in appreciation and to take a look at what's going on around him and just breathe deeply and go into that space of appreciation. So you can do that as well. Set timers to remind yourself to do this in your busy day. The idea of letting go of whatever doesn't belong to you. Oftentimes we take on the energies of other people's traumas or other people's stresses. And that could be at work, it could be your family, it could be, your family of origin. Sometimes if you've been raised by people who were having more trouble in their own lives, that can sort of lay down after a while. And if that's the case, it's sometimes hard to clear energies that don't belong to you. And so finding a way to, first of all, recognize if you're feeling stress, is it coming from you or is it coming from, what's going on around you, can be very helpful. And then the other piece to that is finding a way to have healthy boundaries around yourself so that you're not taking on what doesn't belong to you. And then the other part of this is embracing what does belong to you. Sometimes we're living a life that doesn't really belong to us as much. We've sort of gone along a path that somehow we got on that path. And if that's the case, some of the depression is sometimes just that we haven't asked that question of, is this still what I want? Is this where I want to be going? Is this the path that I see myself on 5 years down the line? And what I would say about that, because sometimes that can bring up some big emotions, is don't make any decisions just listening to this talk, okay? But it's worth the question and finding the answers to that. And if you are on a path that doesn't feel like it belongs to you, then it's worth the time and attention to get on, to figure that out, to figure out what is your path and what is going to bring you happiness in your life. And often isn't discussed. So it's worth the discussion. Love and forgiveness. A lot of times when something has happened to you, the other person has gone on and they're doing their own thing. And if you're still holding that grudge, you're the one paying for this thing that happened to you long ago. And if it's been years and you're still feeling that, then part of your own healing is to find a place of forgiveness or peace around that. And when I talk about that, sometimes people will say, well, I can't forgive them, that was horrible, it was a horrible thing that happened. I get that. I'm not saying to condone that behavior. What I'm saying is to find that place of peace within yourself so that it's no longer continually harming you. And that's a process unto itself too, and it helps to have support and maybe some psychotherapy while you're figuring that out. But that's part of the healing as well. And helping others. There has been also some research around that people who help others tend to be significantly less depressed. There's something about seeing the world as something bigger and being a part of something bigger than yourself that can sometimes help you to kind of pull out of that feeling of depression. And I think the other piece of that is I talked earlier about feeling more connected, and that being a real key to helping you to feel better. Helping others can help you to feel more connected. embrace community. This is a society of loners, and so finding a community where you can hold all the roles of, well, what I say about this is that having a community where you can fall apart and be vulnerable when need be, and there will be people to shore you up. But at the same time, it needs to be a community where you can be the strong one in the group and shore someone else up. So finding that fair share of energies where you're helping and you're getting help. Whoever needs it gets it, can be very healthy. And it doesn't necessarily need to be your family if that's not where you find safety and security and love and peace. But see if you can find a community that you can be a part of that can make that difference. So on the spiritual remedies, when I was talking earlier about my definition of spiritually being about connections, that's what I'm talking about here. And it's kind of what I've been talking about throughout, is finding right relationship within yourself and with the world around you, and finding a way to feel like you're part of something that's bigger than yourself can be very helpful. And so fostering connection is part of the healing process with this. And it can be a spiritual community. I'm going to keep coming back to research. Research does indicate that people who are part of a spiritual community tend to be less depressed, tend to have more support as they get older, and all of those types of things. But it doesn't need to be a spiritual community. It can be a community of friends. It can be your family. It can be finding some group of people who like the same things that you do. But what I would say is, if you can find a community that's not just that you're doing the same things, but that it has something deeper, that you feel that more intimate, deep emotional connection, can make a big difference in terms of depression. And so it's worth exploring and seeing if you can find that. And if you're having trouble with finding that, find some counseling around that so that they can help you as well. Creating balance in your life. There's a lot of workaholism in this world, in this country, and so finding balance with work and home. And on the other side, another common thread is finding balance between yourself and others. Sometimes depression is that you have allowed your well to get dry, and in giving to everybody else, and not taking care of yourself while you were taking care of everybody else. And when that happens, part of the healing is just filling up your well again, and taking care of yourself and putting yourself first for a while, so that you can shore up those reserves. And everybody needs that. And you're not being selfish or low-spirited by doing that. Everybody needs that. The idea behind this is to find a fair share of energy so that everybody's needs are getting met in some way, including you. You are part of the equation. So finding that you are just as important as your family members and whatever good cause you are involved in, or whatever work environment you are in, you have equal needs as everybody else, and I think it's worthwhile to just acknowledge that first and then go from there. And finding a place of peace in general, and I define that as not sweating the small stuff. A lot of our days are spent in worrying about some of the small things that really, if it were a little bit different, it probably wouldn't make a huge difference in your life. And so finding what is important for you, and I don't have the answer to what that is. It's an exploration. But what is important for you that deserves your attention, your energies, maybe your outrage or your advocacy or whatever it might be, is worthwhile. But then having the rest of it go to the wayside. It's just not as important. And finding what you really want to expend your energies on can be pretty helpful. So when it comes to the energetics of this, you can work with that, work with someone who does energy medicine, and that can be helpful. But there's also the part about finding meaning and purpose in your life. And so that's what I'm talking about more in terms of energetics. If you are going about your life and you don't feel like you have meaning and purpose, then that could be a real big cause for depression. And if that's never discussed and all you're dealing with is your sleep or taking the right supplement or taking the right antidepressant and never really dealing with those deeper questions about who you are and, you know, what's your meaning and purpose on this planet, then you may be missing a big piece of the puzzle. So it's worth everybody's attention to see if that's what's out of balance in your life. And the concept of making the world a better place in whatever way that means to you. And it doesn't need to be big. It just needs to be something that you feel has meaning for you, and again has that fair share of energies where it is making you feel good while you're making someone else or a part of your community feel good, or helping the environment or whatever it might be. But you'll know you've got it when you feel more energized because you put your energies into that. If it's draining your energies, then there's some piece of that that's not quite right yet. And so finding your meaning and purpose can be a big step in getting out of depression and finding your path in life. And so I put this slide in here just to bring in the concept of having your life be your grand adventure, living your life as if it were a blank slate upon which to write your unique grand adventure. And if life felt like that, you might have dips and curves along the way in terms of mood, but you'd be probably going a pretty long way in finding peace, health, happiness, and heading in a direction you want to be heading in. So, and on all of the ways that we've been talking about, those are the ways to get there. So Joseph Campbell said, find a place inside where there's joy, and the joy will burn out the pain. I love that quote. It's beautiful. I love this little kid too. He's just so joyous. And so bringing in the joy is how you can ease the depression, and however that means for you. And we've talked about many different ways to do that on the physical, the emotional, the mental, the spiritual. There is no one right way for any particular person. It's trying these different avenues and seeing what are the keys to healing. And what I often say is whatever's up is up for healing. So I tend to follow the energetics of that. I follow the energy. And so if someone comes in and they're feeling depressed and what they start talking about is their relationship with their spouse, that's where we head. If they come in and what they're talking about is something physical, that's where we head. I trust that, and I suggest that you trust that as well. Whatever is up for healing. So follow the energetics of that. Find a way to shore that up, and then work on the next thing. So, thank you.